Hey, good evening, guys. This is Ashton Fisher. The social policy that I chose is homelessness, and the bill that I chose to go with is the Levering Integrated Networks and Communities to Address Social Needs Act. Um, so, as you guys know, the rate of homelessness here in the state of Oklahoma is pretty high. Um, with this act, those people who are receiving community help, um, this will create a system where healthcare needs are linked with social needs. How many times have you guys seen clients come in who are homeless and they are needing health care and for their medical issues or dental care or other social needs such as like job training or etc. But you know, the way that things are set up now, it leaves the burden and confusion of navigating these different systems on their own. In addition, to age-related factors and language barriers and disabilities and, other barriers that come into play. Um, more so with how complex health and social service, housing, and other systems generally, they don't work well together. Um, to provide assistance that is coordinated and dependable over time. And with this bill, if it goes into effect, it's going to be something that is not only for the state of Oklahoma, but it will be nationwide. And each state will receive funding to help put this into play to make it to where their systems are conjoining and make it easier for people to receive the help that they need and make it to where they're not having to try and relay all kinds of different messages because that's the least that they need to worry about on top with everything else that they are already dealing with. And last year with the pandemic striking and the number of COVID-19 cases rising, as well as here in Oklahoma a few months back, we had a terrible blizzard that happened, and many people lost their lives because of not having somewhere stable or safe to go. So hopefully with this bill being passed, we can trek forward and make an impact and hopefully try and get it to where the number of homelessness decreases because homelessness, it's not always defined by not having a stable home. It could entail so many different things to people. Yes, they may not have a roof over their head, but they're trying and they may not understand or know about the resources that are available to them. And I feel like with the baby steps that we are taking, that hopefully in the near future we can take more steps into ending homelessness or coming really close to it. Thank you guys so much for listening. I hope you guys enjoyed. Have a good evening.